Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Support webinar series. My name is Julie Cahoon, and I work for Kaufman & Associates. I will be the moderator for today's webinar. Before we begin, I would like to highlight the main features of your webinar interface. First is the main window where you see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. A Q&A session will take place after the presentation. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You will receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Relationship Building in Indian Country, Outreach and Outcomes. Our presenters today are Clarissa Duran, the Senior Program Administrator for the Rio Arriba County Health and Human Services Department, and Ray Walker, the Divisional Director for the Oklahoma Insurance Department. Thank you both for joining us today. I will now turn it over to Clarissa to offer an introduction to her topic.
Good afternoon, everybody, and thank you so much, Julie, for having us today. Julie, it looks like my desktop is not allowing me to advance the slides, so I'm going to ask you to do that for me. I want to first introduce myself. Again, my name is Marissa Feudin. I'm from Espanola, New Mexico. My mother is from Manassa, Colorado. Her great-grandmother was from Oke-Awinga, Pueblo. My father is from Mora, New Mexico. And I'd like to give honor to our family for always being community organizers who help wherever they could. I'd like to also thank Elder Nathan Phillips of the Omaha Nation for his prayers in Washington, D.C., and just be mindful of the conflict going on in our nation right now, and to thank all of you for coming together today. I want to honor my elders from Table Women United, including Kathy Sanchez, and one of my elders from one of the Mexican nations, People of the Clouds, who have helped me to learn to work through my ancestors and Creator and working with my community. They help me to understand that when I'm working on my task, things come together easily. And in this case, we're discussing the Northern New Mexico Benefits Enrollment Center, which is made possible through a grant from the National Council on Aging. In our Benefits Enrollment Center, we offer many different enrollments, including, if you would advance the slide, Julie, including enrollments for older adults, disabled adults, basically anyone who's Medicare eligible. And we also provide community outreach to support community members who are not older adults or disabled. Next slide, please. We offer enrollment in Medicaid, Medicare, Social Security, Low-Income Heating and Energy Assistance Program, also known as RISE, and the Supplemental Nutrition Assistance Program, also known as SNAP or food stamps. We have a couple of programs that we work with that are nonprofits that can also meet community members' needs that are not necessarily covered by government programs. And we provide case management wrapping around those enrollments. For instance, we recently had an older adult who is from the Navajo Nation. Her birth certificate conflicted with many of her other documents, and she was unable to get her state ID, which she needed in order to get Medicaid through the 1115 Medicaid waiver or community benefits waiver in New Mexico. We were able to work with one of our Congress people to get the MDD to go ahead and work with vital statistics in accepting some of the more traditional documents from the Navajo Nation, and we're able to get her that state ID, a birth certificate with the correct date, and eventually got her onto the 1115 Medicaid waiver, through which she's now eligible for in-home health care, transportation, and various other benefits. We also work with the Federal Distribution Program on Indian reservations, known as Commodities or FDIPR. What has been really good for us in working with that program is that we've gotten to do a lot of outreach. So if we go to the next slide. We have been able to do a lot more outreach recently because our, I didn't say I'm from Eureka County. I think that was on the slide that introduced me, but our county was able to get a grant to have an AmeriCorps Vista program in order to reduce opioid overdose deaths. And we're the first county in the nation to get that grant. We're kind of like a pilot program, so our Vista Volunteers are working with us to help build capacity to reach out there to older and disabled adults, to talk to them about multiple opioid prescriptions that they may be receiving from, their various doctors. We've been able to talk to disabled adults about getting into one of the programs in our community that's pain management that doesn't have to do with opioids. So that's been really good outreach for us. And our food box program has supplemented our work with FDIPR in terms of being able to provide a consistent amount of food for older and disabled adults. We're actually the only food outlet in northern New Mexico focusing on older and disabled adults. And we do have some volunteers who help us pick up food every week. Like today we picked up some food and stocked the shelves, and we've already had 3 families come in and pick up some food. So how we do it is we have a pantry, and we just allow people to shop for what they need because, everybody's needs are different. And a lot of times when you have food that's not really culturally appropriate, you end up with a food box of stuff that you're not going to use. So we'd rather that people take what they need and make the foods that they want to make for their families and themselves. We partner with local farmers markets and the co-op, again, to help older adults to access fresher foods. And our farmers market is really great. They have a grant that allows them to double food stamps or SNAP benefits. So our older and disabled adults, we make sure that they know when market times are, and the director of the farmers market actually helps people to do enrollments right there at her main table. So she's been a great partner for us, as well as I got to give a shout out to the Food Depot in Santa Fe, who provides us with the food through our partner, San Martin de Porres Soup Kitchen. We're actually considered their senior program because big food distribution centers are not allowed to give county government food, but because we are really being more and more recognized in our community for doing enrollment as a very safe space for older adults to come rather than going to our State Department office where you can do enrollment. They feel more comfortable here, our elders do, and we're able to, after their visit with us, their work with us on the enrollment, they're able to pick up a food box or to come in anytime or actually make it available to people 5 days a week when we're open. Next slide, please. So currently, we are working. One of our managers in our department has been meeting with the director of the Northern Pueblos. Governor Vigil is on the board of governors and is their director in terms of, I guess, operations. Our manager has met with him to talk about priorities of the board of governors, and seniors is definitely, we're told, one of the priorities. So we're working to move forward in developing memorandum of understanding so that we can work together with them on any projects they want to work on around older adults. There are 21 pueblos in New Mexico, and I'm located in the city of Espanola. There are 2 pueblos, Okeolinge and Santa Clara, or Capolinge, that are our neighbors. And so having that opportunity to work together, a lot of our seniors, whether they're, whatever their ethnicity, culture is, a lot of them will go to different senior centers based on the menu for that day, which I think is really cool. Like my mom, she's 78. She will often go eat at Capolinge because she likes what they're having better that day than what they're serving here in the city or at one of our county senior centers. So I think it's a really great opportunity for us to open up our enrollment services. And actually, one of our staff people and Vista Volunteers, and I didn't tell you, AmeriCorps Vista stands for Volunteer in Service to America. You have to be 18 or older, and it's a great program for people who are in school or who are retired, because you are required to do at least 35 hours a week of volunteering, and you get a living stipend of close to $1,000 and an educational benefit at the end of close to $6,000. But our staff person and our Vista volunteer have been going out during those commodity days to various pueblos, thanks to the woman who manages that program for Governor Vigil. And so we've been asked by some of the staff at the senior centers in the pueblos to come back more often. And we're working, again, through that MOU and through those senior center site managers to partner. We, in the beginning of our grant, we had a partner. Her name was Pat Fernand. She worked with the Jicaria Nation to help start their health center. So as one of our core team partners, she was working with the IHS staff at Jicaria Apache Health Center and was able to work with them on their enrollment. One of the big enrollments for all older and disabled adults is that 1115 waiver enrollment into full Medicaid, because there's so many benefits to it. And so she worked with IHS staff and offered them any support that they may have needed, and received support for our program from them. So I appreciate that. We have done, and again, we have the USDA food distribution program. And anytime we're talking about food, I think it's a really good connection between cultures. I consider myself to be Chicana, and again, I have my elders in Table Women United. I was a volunteer for them for 18 years, mostly working on environmental issues, because we're right downwind of Los Alamos National Laboratory, and our communities have had a lot of health effects because of all the work that's done up there in terms of making the nuclear pit for atomic bombs. So my work with the Table Women United has just strengthened me in being able to understand what needs to be done when we go, what protocols we may need to follow as outsiders coming into a pueblo, but offering our help. And coming in around food with the commodities program has been a really nice, easy, natural way to to be invited and to be guests at Pueblos. So next slide. In 2018, we just got our results from our program manager, Randy Feliciano, whom we love. He's such a big help to us. We enrolled 812 people in public benefits, and although our official number is smaller in terms of our enrollment of Indigenous peoples, we went back and looked at some of our numbers and realized that some people had checked off the box for having two ethnicities, and so our true number is 120 people in the Jicaria, Tewa, and Dene tribes. We completed 2.62 enrollments per person, and that's one of the things that National Council on Aging makes sure that we do, is we're not doing standalone enrollment, because normally when we're dealing with older and disabled adults, we're dealing with people who are on limited income. And so it's really looking at the entire financial, economic piece for an older or disabled adult. Often when we start in on, let's say someone just says they just want a SNAP application or they just want a LIHEAP application, it turns into much more. We've helped some older adults get into public housing, and we're really lucky to partner with our soup kitchen because they have some priority in getting housing for older and disabled adults through our public, both our county and our city public housing. So we've been able to help people in multiple ways. And we refer people a lot to our New Mexico Aging and Long-Term Services Division. Their ADRC really can help people enroll in Part D. That's something that we work on sometimes here, but we feel like they're better experts that the ADRC will reach out to help for help from them. So, next slide. Some more results are that we have increased access to in-home health care by increasing enrollment in that full Medicaid through the 1115 waiver. And by doing that, by increasing that access, we have also created jobs in in-home health care, because every new person who receives a Medicaid waiver coverage and is eligible for in-home health care and chooses to take that up, there's going to need to be a caregiver for them. So often that means family members who have already been providing that care will now be able to be paid for at least part of the care that they're providing. And that can also really impact a family's home budget. So that has been a great addition for northern New Mexico. We're so rural and we have such a large frontier area that jobs are often really difficult to come by. And since they're already doing the work, it's great to have that money coming in. And we do actually, in my division, we have a small in-home health care program where we manage 7 families who have family members that are providing care to older adults who are very disabled, who are getting that in-home health care benefit. And we have also expanded the ability to have a larger adult daycare. And how we're doing that is, again, helping people to get on that expanded Medicaid. Our adult daycare that our county department runs is planning on expanding, and having Medicaid dollars will be a really good opportunity for us to be able to provide more services to those adults who are in the adult daycare. Next slide, please. So, in working with my staff, we always sit down and not just at the beginning of the year, but definitely at the beginning of the year to talk about what our visions are for our work going forward. And we're definitely focused on deepening our relationship with the Northern Pueblos because, again, they're our neighbors and they're our family members. And it's so important to me to try to help unify the county and our Pueblos so that we are providing seamless service for older adults, our disabled adults, for our community members, and especially because we have so many grandparents raising grandchildren in our public schools. It's been reported that 60% of our children in the schools are being raised by their grandparents. So for me, I grew up as in a home with two parents, but I was a single mom, and my kids really were lucky to be raised by not only me but my parents. And I know that's a very traditional thing, both in Indigenous and Chicano life, but it's very different now with the opioid epidemic claiming so many adults, so many parents who are either incarcerated or, are suffering with substance abuse issues or who are no longer with us, that those grandparents get that support. So we have, our county department has not our department, the seniors department has an advisory committee, and that committee reports directly to our county commissioners, and they advise the commissioners on what's going on in the senior centers. So we do have two people who belong to the Pueblos who have attended off and on, but we do need more participation from our elders from our Pueblos to be that voice to our commissioners on what Pueblo elders need, because the Pueblos are our neighbors. They're within the county boundaries. So it's so important to have those voices, and we are focused on helping to make that happen. We also want, again, to extend some services for grandparents raising grandchildren. We have organizations that focus, mainly on those grandchildren, but we have heard from grandparents that one woman said that she wished that when she first got her grandchild, who was an infant, that there had been a team to help her understand what she needed to do within those first 24 hours, because she had no clue how to navigate the system of law, how to navigate the Income Support Division office to get benefits. And so anything that the agencies who are working with grandparents raising grandchildren are not doing, we have reached out to them, and we're working to help provide those services to those older adults in co-housing situations. Next slide. So again, I want to thank you today for allowing me to speak to you and to talk to you about our outreach. One of the things I didn't mention is that we started our Benefits Enrollment Center by starting out with listening sessions at every one of our senior centers. And that's something that I was taught by my family and also by my Native elders, that when elders speak, younger people listen. So being a younger person at those senior centers and trying to develop these programs, I first started out by listening. And in doing that, we were set on a very good path. And I have to say that that path has allowed me to continue working and building more of our programs through the grace of Creator and my ancestors, and also through the wisdom and the assistance from our elders and our senior advisory committee, and those seniors who take time to express their needs to us in all of the senior centers. So if you'd like to contact me, there's my email address, and I'd be happy to hear from you. I'd love to get feedback from you in what might help us do more of our work. So please feel free to email me anytime. Thank you. And Ray, I'll leave it up to you to take over from here. Thank you so much.
Okay, can y'all hear me now?
I can hear you.
Okay, great. Sorry about that. I had a little phone glitch that Kebby from Connecting. My name is Ray Walker, and I'm the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Basically what that means is that we have the grant for the SHIP program and the S&P program, and we partner with Aging Services at DHS for our MEPA grant as well. And so what you're seeing on the screen here is a map of Oklahoma, and when the indigenous people of this country were relocated to other parts of the country, many of them found their places in Oklahoma. Oklahoma is home to 38 federally recognized tribes, and you can see their land areas here on this map. The little inset under the panhandle shows it's sort of a blow-up of that small section up in the corner to the right of your screen of the tribal lands of those tribes as well. So, as I said, we have 38 federally recognized tribes, and we currently have working relationships with 24 of those, and that's either directly. In other words, me or my staff at the insurance department are working directly with the people at those tribes, but also we're fortunate that we have some agencies with whom we contract, such as the area agencies on aging, who also provide outreach and support to some of those tribes. So some of our relationships with these tribes are actually through those contracted agencies who have been working with them and providing services for a number of years. In addition to that, we've also been fortunate in that there have been individuals within those tribes and health clinics who have expressed an interest and gone through the training that we provide to counselors. That training can be on just general Medicare. It could be on fraud-related topics, since we have the S&P grant, but also they're very interested in learning about the assistance programs that might be available to assist their elders. So we currently have trained counselors in over 20 tribes or clinics around the state. And as far as who those people are, who those counselors are, their roles vary. In a lot of situations, those people are patient benefit coordinators, but they also are in different roles, social services, and other things like that, who are trying to help those elders maximize the benefits that are available to them. Also, we find that a lot of the interest in our programs and our services comes from people who are providing direct health services to tribal elders. I've listed here, and please don't consider this a comprehensive list. Don't, go and print this off, because this is basically what we could find off of the internet. And I know that some of the folks that are listening on the call, I was looking at the participants. These are people that I've been fortunate to work with among some of these tribes. So I'm kind of interested why they're not the ones doing this presentation. But be that as it may, as you can see here, several of the tribes, and this is by no means a comprehensive list of what's available in Oklahoma, but this just gives you an idea of the reach of these nations in terms of providing health services to their everyone within the tribe, but also those tribal elders. And as you know, the funding for the services that are provided, this is coming from IHS, this is coming from tribal funds or Urban Indian Health, this thing that we call ITU and stuff. And so there are services that are available to these individuals, but as we all know, sadly, sometimes those funds are very limited, or the services that can be provided through these outlets can be limited. And so they at times are having to refer services out if that's a possibility. So anything that can be done to maximize the revenue resources to the tribes as well as IHS is going to be of benefit. So we work very closely with the staff within these tribes and clinics to educate elders on the benefits of enrolling in Medicare, of enrolling in assistance programs and things like that, and how that opportunity can bring additional funding into the health system, or at the same time, it expands the resources that are available for health care to those tribal elders. So our activities and strategies, I've been doing this now for 8 or 9 years. And in the beginning, as so often is the case, we try to start at the top. Let's go to the head honchos and get their buy-in on our program. And this was incredibly educational, but it wasn't always effective in terms of the outreach, because those individuals, and when I say the tribal leadership, I'm not necessarily speaking of the chief or the governor of the nation. It's just an individual who is in a leadership role. Those people, who are tasked with seeing to the benefits of their people. And while they were very interested and they believed in what we were doing, they couldn't necessarily spare the time or resources to provide the support that we were trying to get to expand the reach of our program. They had other priorities, other needs that had to be met. Also, their understanding of Medicare versus Medicaid. And I know if any of you who have dealt in healthcare systems understands this, it's still frustrating to me whenever I hear people using the term Medicare and Medicaid as if they're interchangeable. And so it's difficult for some people to understand the need and the possibilities of expanding in these other healthcare systems. And then also, the other component of it is we still are in an age where there's still some issues and some concerns about dealing with government and government offices and stuff. Many of the elders who are currently still with us remember a lot of the things that have been done in the past that weren't particularly fair to the indigenous people of our country. So there are at times some pushback there from a concern from past experience. A part of what we have had more success with is invitations that we've had to participate in events around the state that help us connect with the various tribes and clinics. Some of these are through government agencies or the AAAs that we've contracted with, things like health fairs, opportunities to speak at congregate meal sites and senior centers. I had an opportunity, it was either last year or year before last, to travel around the state and speak at the Chickasaw senior centers. And we did this alongside staff from the tribe who came along with us, and together we worked as a team to, one, talk about Medicare, the opportunities with Medicare, and the pros and cons of getting enrolled in Medicare. And at the same time, those folks that were there from the tribe were able to speak on the topics that were specific to the Chickasaw Nation and kind of help them understand how those two systems could work together to the benefit of both the elder as well as the nation. Also, there are other events, the government agencies, such as these Oklahoma Tribal Leadership and Advocate Summits that Social Security puts on for us to educate and develop relationships with tribal contacts. Also, as I stated earlier, we've trained several tribal representatives to be counselors. We put them through the same training that any of our other staff go through. And that has been very, very beneficial. We have learned by no uncertain terms that often tribal elders are much more comfortable dealing with someone within their nation, or at least someone who is of tribal descent. And so by having those counselors who are already trained, it increases the likelihood that that elder is going to seek counsel and assistance from that individual. So not only have we invited folks from across the state to come to our training, but I've also been privileged to be asked to come and actually do training specifically within some of these nations. We've done on-site training for the Cherokee Nation, the Chickasaw Nation. We've actually done multiple trainings, and in the Muskogee Creek Nation as well. We've done this and have actually been invited in a few months. I think I'm going to be going back to an area for the Muskogee Creek Nation to counsel some additional counselors. some additional members of their staff, and that's because, as with any position, there is staff turnover. So some of these individuals that we've trained in the past may have gone on to other roles, and this keeps somebody on staff that can answer the questions these people have about Medicare and the assistance programs. I also just did a training a few months ago, actually, at Lawton Indian Hospital, and that was very nice because they opened the doors to not just the staff of Lawton Indian Hospital, but representatives from the tribes and clinics in the area. So that was also very useful. And this is good for me. Not only am I helping educate them about Medicare and the options that are available to their elders, I learned so much from these interactions about the individual differences within the health systems among these tribes and the benefits that are available to their people. It's also beneficial because frequently a person within the tribe or clinic or hospital will have an interest in learning more about Medicare, but by attending this training, it gives them an opportunity to decide, do I want to act as a full-fledged counselor and have people coming and working with me specifically, or do I just want to know where the resources are that I can refer these people to, either within the tribe or referring them directly to us to work with. So that's also been very interesting. Another area where we try to provide assistance is that of like printed materials. Oklahoma is a very rural state, and there are clinics all over the state where the American Indian population can go to seek services. And it's not always easy for us to get to those clinics. And again, in some situations, they would prefer to deal directly with their elders and not have outside involvement. And so if we can at least provide them with printed materials where people can get answers to their questions, and in some situations that may be a brochure that's specific to our program. We've got materials that we've created that explain what the Medicare Assistance Program, or MAP as we call it for short, and the services that we provide. But in some situations, there are materials that have been created specifically to speak directly to American Indian elders, and those have been created by other agencies and such. And so what's nice about this is it gets our information possibly in front of other individuals who might need that information and who are then able to access our services via our toll-free number. And we've got someone that answers the phone 24 hours a day, 7 days a week. But there can be a negative side to the printed materials in that we don't have very much control over how those materials are distributed as far as where they're located, and if people are actually, the people that need to get this information, if they're actually receiving it, as well as the fact that sometimes it's hard to control outdated materials. If materials have specific numbers that might change from year to year, if the wrong information is out there, that can create problems. So we're also finding, quite frankly, as I think everybody is, people are picking up brochures and such as much as they did in the past. They tend to use the internet much more, and that is certainly true of the elder population. Seniors are the fastest growing population of internet users out there right now. So we try to temper that with, how much are these materials being used. Here's an example of one of the items. This was actually created by NCOA. This was specific to educating people about some of the assistance programs. This isn't the complete piece. I just had kind of cut and pasted the top of the page of this one item that was created. I know that SMP, the Senior Medicare Patrol, on the Medicare fraud side, worked very closely with the International Association of Indigenous Aging to create specific fraud-related materials, and we use those in our outreach as well currently. So also another opportunity, and I've been very fortunate to be asked to participate in these, is participation in tribal events, things where they're bringing together their elders for educational purposes and social purposes and such as the Chickasaw Nation. They do a huge elder conference every year. They have great turnout. They have people who participate from across the country, elders who come to this event. And there's representatives of several different programs that are available there, and I was very fortunate to be asked to participate in this event, as well as the Cherokee Nation. They've been doing elder summits for a number of years, and again, I was allowed to come and do some education on Medicare fraud, as well as providing information about the other services that we provide through Medicare. And this is just an example. We've done events with other tribes and clinics and stuff around the state, and I'm always very honored when I get asked to participate in these things and to help them to build the programs that they've got that reach out to those elders, because, as I said before, if we can utilize the resources that are available out there to maximize the funding as well as the resources to improve the health care to those elders, it's a win for everybody. And then lastly, if we, along with everything else that we try to do, if we can do nothing else, we try to make sure that the people who are the frontline folks who are trying to help these people with their benefits, which is typically the patient benefit coordinators, the PBCs, if I can just help hook them up with a trained Medicare Assistance Program counselor so they know where they can go to get answers, that's very helpful as well. Had an opportunity just this morning. I was talking to someone from Social Security about an issue that they were having, and it just so happened in the course of the conversation that she mentioned that she was actually working with one of our counselors who was actually in the absentee Shawnee tribe. And once we made that connection, it was pretty quick work for us to put together some options that worked very well for the client, or at least we hope they're going to. We're still trying to make sure that this works out, but it's that networking, it's that working together to the benefit of those elders that really makes a difference in their lives. Some of the challenges that we have faced, one, again, is the varying attitudes towards government programs. As I said before, these elders were around during the time when we still had the American Indian boarding schools, where people were sometimes removed forcibly from the home and forced to live in a facility where they were, for lack of a better term, tried to make them Americans. And so that doesn't really sit well with people. And so there can be some distrust in there. Staff turnover has been a huge issue for us. Now, sometimes that could be because the person got another job, but in other situations it could be that there's a change in leadership within the nation, and the new leadership does not put the same priority on the programs that you're talking about as did their predecessor. And so that changes the priorities of the system as a whole. So sometimes we've lost some footing in the past whenever that has occurred. And a lot of times when these changes occur, we're not aware of them. It's not like we're on a distribution list that says so-and-so's not working in that job anymore. And so frequently we find ourselves where we think we're making progress, we wind up back at square one. So that can be quite frustrating, but if nothing else, it certainly teaches you to be very flexible. Another big challenge is receiving data. Like any other grant-funded program, it's run on data and the results that we can provide. But these individuals who are working as counselors within the tribe, they are not just doing the work of our program. They have many, many other duties. And subsequently, with those duties, they've got documentation that they have to provide. And so often it's not possible for them to document the same information in multiple systems. So we continue to try to work around those issues to come up with a solution of how we can substantiate the work that we're doing and the assistance that we're providing without creating additional work for those people who have so many other duties. Pardon me. So lessons learned. One, you have to recognize that each of these tribes is a sovereign nation. They have unique cultures, beliefs. Their values are different. You can't go in with a one-size-fits-all attitude when it comes to the American Indian Alaska Native population. Secondly, I've learned the hard way that you need to go in and let them know what the services are. Let them know what you're able to provide, how you can assist them in doing their work as well as assisting the elders. And then, let them digest that. They will, if what you've got is something that they believe will assist those elders, they will seek you out. And then as you are assisting them, it's a very good idea to provide them with the assistance that they've requested, but don't overstep. So often we feel like, kind of the traditional Americans, we feel like once we've got our foot in the door that we can just, but now look at all this other stuff I can provide to you. Again, make them aware of the services that you can provide and allow them the opportunity to come to you in those situations where they need that assistance and that you can provide that. If you start overwhelming them with other things and stuff, it won't be appreciated. Another hard lesson that I learned is don't just automatically put everyone on your email distribution list. Not everyone wants every message that you get. I tend to get a lot of information from entities such as CNS or Social Security and other agencies, and I'm always wanting to pass that information on to others because I just assume they all want it as well. And it, again, can be overwhelming. These individuals have other responsibilities and other priorities and stuff, and just getting hammered with all of this other email isn't always appreciated. So ask them if they would be interested, what type of information, and then be a little bit more selective about what you're providing to them. And then again, patience. There is a long history of reasons why the relationships can sometimes be difficult to create with the American Indian population, and it's very well understood. So it's so important to be patient and to allow them to set the pace, and just try and be available when the opportunity does present itself. Be prepared for setbacks, like I said, staffing turnover, changes in leadership and stuff, and just if nothing else, it really creates a great opportunity for you to develop your relationship building skills. And I've been very fortunate in that I feel like I've got some very strong relationships within the tribes here in Oklahoma that I've had the opportunity to work with, and I'm going to try to continue developing those in some of the other tribes in the years to come. So I will turn it over to Julie for questions and comments.
Great. Thank you, Ray, and thank you, Clarissa, both for your presentations. Those were wonderful. So, audience, this is your time to ask questions of either Clarissa or Ray. So you can enter your question in the Q&A pod located at the bottom right side of your screen. And so we have about 10 minutes remaining until the top of the hour, and so we'll go ahead and take questions until time is out. So we already have a couple questions that have come in. So the first one is directed towards Clarissa. The question is there a social determinants form that must be completed for families who need to access the food pantry?
Well, every form can only be filled out to the person's comfort level. In our form, there is no social determinant necessarily. The form comes from the Food Depot in Santa Fe, and it requests people's name, what the date is, how many males, and what their ages are in each family, and a signature from the person and their phone number, so that it just verifies to the Food Depot that actual people are getting the food. And then they can figure out what age groups are most vulnerable in our state. And the phone number is great for us because we call people each week to make sure if they haven't come for a food box that they remember to come for a food box if they need one. But we're advocates for people that we work with, that they complete things to their comfort level. I think it's so important to be able to say no when you're uncomfortable.
Okay, great. And the next question is for you as well. What are some of the challenges of doing outreach in areas with limited internet? Have you found that this impacts the telehealth initiative?
Right now, our county is actually working to try to do telehealth at our detention center because it would be so much more cost effective. Our county seat is actually in our frontier area, and that's one of the challenges that we're looking at, whether that can work. Here at our office, hilariously enough, my internet is not working, so the only way I was on this presentation today was by phone, and I got through my part of the slides, watching my part of the slides that Julie was moving for me by being on my phone. But as soon as Ray was on, my phone went down too. So, yeah, there are huge challenges in terms of the internet, and that's one of the reasons why we always have paper forms with us wherever we go. And we don't try to work with our elders on a computer, although some may be more tech-savvy. A lot of the older adults in our community just are not. So just providing support in a way that people are comfortable.
Okay. And a final follow-up for you as well is there a follow-up and or method to close the referral loop for the patients that you work with in your program?
So in terms of follow-up, I would say that's one of the things that we're best at. Our Medicaid enrollment through the 1115 waiver, minimum 90 days, maximum has taken someone an entire year to get all the documentation that the state kept requesting from them. My staff person is extremely tenacious. She's a veteran. She was worked in a women's camp in the Middle East, and she just is extremely attentive to detail and people's needs, and really, really has the heart for, making sure that each person, that their needs are fully met. So she goes well above and beyond any needs that may be presented with enrollment. I mean, I think the families that work with her kind of adopt her because she's so great.
Okay, that's great.
I want to. I didn't really give enough recognition to our Vista Volunteers. Our two young people who are working with us this year are so incredible. I mean, they help our elders shop. They take their food boxes out to the car for them. They are so polite, and I know that it always warms our elders' hearts to see young people providing service the way that these two young individuals do. So we are really blessed with them.
That's great. Ray, so the next couple questions are for you. The first one is, how are the tribal representative counselors paid, or do they volunteer?
Good question. They're not paid by our program. We consider them in-kind paid because they're being paid by, whoever if it's through the clinic or the tribe or whomever. And this is just something that they're doing along with their regular job duties.
Okay. And the next question is, are SHIP program services only available in Oklahoma, or can tribes in other states reach out for help as well?
Absolutely. There is a SHIP program in every state. And if you wanted to identify what the SHIP program is, who the SHIP grantee is in your state, you can, I would be happy to answer that question for anybody who wanted to know. But you can also go to the website, which is SHIP, S-H-I-P as in Paul, T-A, T as in Tom, A as in Apple, Center. So shiptacenter.org. And on that first screen, it's got a locator that you can identify who the SHIP program is in your state. And the services that we provide are identical to the services that they provide. Now, in Oklahoma, we are a co-located program in that we have the SHIP program, the S&P program, and the NIPA program in one office. In other states, all three of those programs may not be available in the same office, but they could certainly assist you in identifying who the grantee is in that state if you go through the SHIP office.
Okay, great. So our next question is, if both of you could provide a response, that would be great. Ray, we'll start with you. How would you recommend doing outreach to urban Native individuals who do not live near a tribal office?
In Oklahoma, we're fortunate in that we've got an urban Indian health center in both, pretty much as far as urban goes. You've got Oklahoma City and you've got Tulsa. We're not a big urban state, and I think New Mexico is probably the exact same way. So, but we do in both of those offices have urban Indian health services facilities. Oklahoma City Indian Clinic is one of them, and we actually have, I believe it's two or three trained counselors in that facility that work with those individuals, and they contact us if they have questions that they're having difficulty with, or if they need some additional information and stuff. So that's kind of how we handle it here in Oklahoma.
Well, quite honestly, we don't have a lot of people that aren't near their tribe, but the people that we have worked with, we just worked with them. I mean, we didn't necessarily reach out to the IHS offices from their nations. We didn't reach out to the IHS office that's close by here. We just, the person who needed that ID in order to get Medicaid, my staff person, like I said, she's tenacious. It took her about 6 months, but, quite frankly, she had worked with some of our congressional delegation. They weren't able to get it done for this client, and my staff person was. So I don't know. Maybe you need to hire another person like my Stephanie.
Okay, great. So the next question is also one to both of you. So Clarissa, we'll go ahead and start with you for this next one. Do you have any recommendations for how to proceed when outreach attempts or trying to engage with tribal representatives are not successful? Are there other strategies you might recommend?
I always think that there's two ways to work on a project, and that's because I work for county government. That's government-to-government relationship is on one level, but then person-to-person relationship is a whole other level. So for me, it's not hurrying things. You might get a no, and one of the reasons why you might get a no is because people don't know who you are. So the thing is to make yourself known in any way that you can. I volunteered 8 years to be the registrar for a traditional seed and agricultural conference I came out of one of the pueblos here, Topeka Pueblo, and I volunteered for Tewa Women United for 18 years. I think you have to pay your dues. And if that's not possible, I don't know. I also am a member of the Lions Club, so we offer glasses for people who can't get glasses. I mean, maybe you have something in your life that you do that you can make an offer of. I also am part of a jewelry selling business, a national jewelry selling business, so I usually offer gift certificates to raffles for senior centers just because I want to be able to give back. And, you know, doing things for people, I find, you know, if you're on your path and you're putting your work out and you're putting your heart out, eventually, you know, you will get what you need to keep going.
Okay, thank you for that. And Ray, what is your recommendation?
I agree with everything that Clarissa said. We have experienced exactly what you're talking about. We've had situations, as I said in my presentation, where we've had very strong relationships and we're involved in multiple programs within a specific tribe. And then all it takes is one change. And if that individual who is in a leadership role decides they don't want to work with you, it's done, and the curtain drops, and there's nothing you can do. And all you can do, as Clarissa said, is be patient, continue, putting feelers out there and trying to make connections and stuff. And eventually an opportunity will arise. It may be working through a different clinic within that tribe or through a different office. Because keep in mind, it's not just the clinics or the health centers that are interested in this. Programs that are looking at housing, programs that are looking at nutrition, they're also interested in helping those elders maximize their resources and their benefits and stuff. So there are other avenues within a tribe, not just through health services, through which you might be able to make some inroads so that you can assist those elders.
Okay, perfect. So we have come up on the top of the hour, so I'm going to go ahead and wrap up our discussion today by first thanking both Clarissa and Ray for joining us today and sharing information about the outreach approaches their programs take to connect with their local communities. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.